Hello, everyone. Good morning, good afternoon, and good evening to you all. It is my absolute pleasure to introduce you all to session 3 of today's wellness event. Please feel welcome to say hello in the chat box and let us know where you're joining from. My name is Amy Staley, and I am a registered nurse at New York Presbyterian Hospital, Weill Cornell Medical Center in New York City. I am also a Nursing Now immunization advocacy champion and co-chair of the Nursing Now Challengers Committee, America's region. I spoke publicly as a registered nurse for the first time in May of 2021 at a virtual Global Footprints event, thanks to an incredibly kind leader at my hospital who you may have seen in the last session, Miss Rhoda Radula. She planted a few seeds and invited me into this beautiful world where nurses empower, uplift, and support one another. This world that I refer to is the Nursing Now Challenge Network. On that same day of my very first speech, I took an avocado seed and placed it into this vase that sits beside me today. I had seen some people growing avocado seeds on social media throughout the pandemic, and I thought that they were so beautiful. So despite the fact that I do not have a green thumb, I thought to myself, I'm a nurse. If I can place a small tube into a tiny vein during an emergency, push life-saving medications through it, and call it an IV, then I can certainly turn a seed into something pretty. So just like I tend to my patients, I tended to this silly little seed, and now it's this beautiful plant rooted with kindness, humanity, and the generosity of those who have helped me grow throughout this network and profession. Nurses are experts at turning illness into wellness. However, the past few years have made it particularly difficult for nurses to care for themselves. You have been asked to create sunshine where it did not exist, spread soil as thin as you possibly can, while the rest of the world continues to pick your flowers. It's rewarding, but it's exhausting. And if you're feeling that way today, you have come to the perfect place, because the speakers that I'll be sharing with you here today are here to share their tip-top wellness tips for restoration and self-care. So without further ado, I'll leave them to plant our seeds for today. Our first speaker, Dr. Zoe Fisher, is a consultant clinical psychologist and an associate professor who will be speaking about well-being through connection to self and the natural environment. Dr. Zoe Fisher works closely with Same You, an international charity organization which was set up to change the provision of recovery services to help young adults recover after brain injuries and strokes. Thank you so much for joining us, Dr. Fisher, and we're so excited to hear about all of your work.
Thank you for inviting me. So before I start, I guess just waiting for my slides. Okay, here we go. So thank you for everyone for coming. I work both in a health board, working in neurorehabilitation, hence the connection with Same You. And I've been working with the charity, the brain injury charity Same You, for many years now, and I know there's a special place in their hearts for nursing. So I've come here today to give back on behalf of them some of what I've learned about health and well-being in the past 12 years. So my work in the health service has involved working with people with brain injuries to rebuild their lives after catastrophic events, really, that have changed their lives beyond recognition. And that got me thinking about how can we improve our models of healthcare to think about really building well-being rather than just focusing on reducing impairments or trying to reduce distress. How can we help people live full, well lives? So I want to take some of that learning from that space today to talk to you about some of the things that I've learned, but also since 2018, I've been working as an associate professor in Swansea University, and we've been looking at theoretical work, really to think about what well-being actually is. It's a term that we throw around a lot, and it means a lot of things to a lot of different people, and that meaning can vary across different contexts, across different countries, across different cultures. So it's about kind of thinking about what does that word well-being actually mean? Because if we have a better understanding of what it means, then we can think about what are the determinants of well-being and how do we improve our own well-being. So those are some of the insights I want to share with you today. Can we move to the next slide? So before I talk about some of our work, I just wanted to acknowledge some of the people that have contributed to it. So my colleagues are from our research group, Professor Andrew Kemp, Katie Lowery and Jess Mead, who are our PhD students. Thank you. Can I move to the next slide? So some of the key points that I wanted to get across in today's presentation, I've tried to make it really practical, but there's just some key things that I wanted to share with you from our work that I wouldn't necessarily have thought about before I started doing this. And the first thing is about when we talk about well-being, particularly in the West, and particularly in health services, we're talking about the absence of impairment. So when we talk about health, we talk about the absence of impairment. And when we talk about mental health, we talk about the absence of depression or anxiety, but we're not talking about well-being. So the first thing I wanted to get across is that well-being is not the absence or reduction of impairment or distress. That well-being is not just about positive emotion, because I think sometimes when you say that word, people tend to switch off because they're thinking of that people are talking about rainbows and unicorns, don't they? So it's not just about positive emotion. It's about learning from what negative emotions you're experiencing, learning how to accept difficult emotions, and growing through adversity is also critical to well-being. So when we talk about our models of well-being, what we're talking about is emotional balance. So having a good balance between positive and difficult emotions, and being able to make room for the difficult experiences that we all have in life. There's a tight couple in between the mechanisms that underpin health and well-being. And so again, I'm speaking to you from the United Kingdom, but in the West as well, there's a very there's this kind of idea that's enshrined in our societies and potentially our health services that mental health and physical health are separable. So that is really at odds with the science, and that kind of belief that prevails through societies is quite limiting in terms of thinking about our own well-being. So what I wanted to talk about today is this tight couple in between the mechanisms that underpin physical and mental health. Because once we've understood that, we know that if we want to improve our physical health, we can work on improving our mental health, and vice versa. And if we believe the two things are separate, the body and mind are separate, 50% of the interventions we could employ to help ourselves are not available to us. So I also want to talk about well-being, because I think often when we think about well-being in work, and I think it really, the term can become quite controversial, because sometimes it's quite easy for employers to say, well, we'll send you on a resilience course, because well-being is understood as something that is in complete control of the individual. But we need to think about well-being as being that we can control our own well-being to some extent, but also we're reliant on the institutions that we work in, the communities we work in, to also support well-being, because resilience courses are not useful when you're drowning in an unsustainable workload. So I think it's about kind of thinking, one of the things that I'm very passionate about is thinking about well-being across many different systems or layers. So thinking about individual well-being, but also about how communities can support the well-being of individuals, and even wider, how the planet can support the health and well-being of the individual. So, so one thing that I wanted to talk about is that well-being is often thought about within our control, but socio-structural factors, for example, how much money we've got, the well-being of our communities and our planet have a profound impact on individual well-being. And I wanted to end by making the point that there's a reciprocal interaction between human well-being and planetary well-being. And obviously talking about climate change and the impact, the increasing impact that is going to have on the health and well-being of the population is no small feat. But I wanted to make the point that if we're to continue to derive benefit from our natural environments, we have to consider well-being through the broader lens and look at ways to simultaneously support our own well-being as well as the well-being of our planet. So I hope that kind of makes sense and sounds like something you might be interested in for the next 50 minutes or so. Can I move on to the next slide, please? Okay, so thinking about, so I've kind of already alluded to what well-being isn't, and it's not about just thinking about reducing distress or depression or anxiety. And there's a really nice quote that well-being doesn't simply emerge when the swamps of suffering have been drained. So if that's the case, then what is well-being? And through our kind of extensive theoretical work, exploring this question across different professions and disciplines, what our group would describe well-being as positive psychological experiences that can be promoted through a sense of connectedness to ourselves, to our communities, and to our environment. So sometimes I guess we were asked to describe well-being in a word, and if we have to be that reductionistic about it, I would say the word connection. So when we've looked at what the core determinants of well-being are, like I said previously, we've looked at balanced minds is a core determinant of well-being. So that is both the experience of positive emotions, but also the ability to learn from and accept difficult emotions and experiences that everyone experiences as part of life. People that are constantly in pursuit of positive emotions and try to get rid of negative emotions are actually some of the unhappiest people. So it's about kind of an acceptance of balance that's really important. Healthy bodies is really important, and I'll talk to you about some of the components about this. This is not going to be news to you. Everybody knows this, but I'll also talk to you about healthy habits to think about how do we take some of the stuff that we all know and actually try and translate that into some behavior change. And connection to nature is really important. As well as meaningful relationships with others, including our communities. Okay, next slide, please. So those are our sort of 5 domains, and I'm going to talk to you a little bit more about them. But I just wanted to talk to you a little bit more about this kind of idea about body and mind being separate. Again, I'm very aware that I'm speaking from a Western society, and that might not be everybody's experience in the room. But because we have historically come to understand that physical and mental health are separate from each other through all the narratives we hear, very often we don't think about improving our mental health in order to improve our physical health and vice versa. And so one of the things that we've been doing a lot in our group and much other research in the literature is now showing that body and mind are, of course, intimately connected to one another. And some of our works talked about the vagal nerve, as being a key structure in uniting body and mind. So this is really important to understand. So because it kind of really helps make sense of some things. So one of the studies that first got me interested in this line of work was the idea that people that were more optimistic, for example, had lower mortality rates and superior cardiovascular outcomes. And I think there was a study by Seligman that showed, well, firstly, once you've had one heart attack, your risk of having another is increased in the first few years. And when they did a study to look at, of the people that had had one heart attack who would go on to experience a second one of the protective factors, in addition to things like the obvious ones like cholesterol and blood pressure, was actually levels of optimism. That's a kind of really good point, that like learning to increase one's state of mind can actually support cardiovascular function. And again, things like loneliness and generalized distress and depression and psychological distress have also been shown to increase risk for all-cause mortality. And we're starting to see now links between things like cardiovascular disease and depression, suggesting that there's common pathways between the two things. So I think it's just important to make that clear, that if we're thinking about improving our own well-being, actually thinking about improving our physical health is just as important as operationalizing some of the more traditional things that we might look to, like yoga or meditation or mindfulness, etc. And potentially that kind of improving physical health mediates improving mental health through the vagal nerve. And I've put anyone that's interested in that from an academic point of view, I've put a reference there that we've recently published to talk about that. Next slide, please. So again, talking about balanced minds, again, I'm just going to say that that's about thinking about finding ways to increase positive emotions, but also not to just dismiss. I don't want to use the word negative emotions, because that's an unhelpful way of thinking about it, really. I just wanted to make the point, really, that all emotions are helpful. They're adaptive at some point. Just to give you an example, I read something on a forum the other day where someone had said that they'd gone up one of the highest mountains near where I live, and they were getting to the top and they'd started hyperventilating because it was really windy and the weather was getting really bad. And they said they were really disappointed in themselves because they had a bit of a panic attack near the top and they weren't able to get to the top of the mountain. And they were kind of explaining that like anxiety got in the way. And I kind of was thinking, well, actually, your body responded really helpfully in that situation, because there was really poor weather. You were trying to get to the top of a very windy mountain, and your body gave you a signal that actually that was dangerous and you needed to go back or to get to safety. So I think sometimes we try and get rid of negative emotions or think about them in the wrong way. So the first thing that I wanted to talk to you really about is, I found it really helpful personally, and working with patients, to try and find the value in some of the negative emotions that I've experienced or the patients have experienced, and to think about what is this emotion trying to tell me. Sometimes those emotions go on too long and they become overwhelming and unhelpful. And then obviously you think, well, I've learned what I can from that. However, then I think the people that are trying to get rid of those emotions by distracting themselves or doing other things or constantly pushing them away, actually say the more they do that, the bigger that emotional experience gets, the more overwhelming it can get. And so in our line of work, we use a lot of teachings from acceptance and commitment therapy to help people just make room for emotions. And if I had to just share a practical strategy to think about when you're feeling overwhelmed, it's just sometimes to just create the space to feel overwhelmed and give yourself permission to feel how you feel, rather than labeling it as bad or negative. Just give yourself permission to feel how you feel. And sometimes that can be quite helpful in terms of being able to process that experience. The other thing then is to say that I guess sometimes people say they become really overwhelmed with difficult experiences when they're stressed. And then there's also room to try and improve positive emotions. So I'll come on to that a little bit. But one of the key things I work with patients about and staff about is just thinking about making room for it and not necessarily labeling something as bad and trying to get away from it, because that can make it worse. Okay, can you share the other slide? So this is another really practical technique again. I'm still talking here about difficult experiences, but I think it's important to acknowledge them, especially in the context of some of the really difficult work that people do. So this is the absolute easiest technique in the world that I share with people and I find so useful. And this is just a really simple breathing technique, which I kind of feel like is a bit of a hack when you're feeling stress. Because sometimes when you feel really stressed and your breathing gets really, your heart's beating, so potentially before a difficult procedure that you might be doing, an interview, a presentation, for example, and you're starting to feel really stressed and you can feel your heart beating. One thing that is really helpful is just to say to yourself, this is a helpful response. My body's preparing me for the moment. I'm getting more oxygen to my brain to help get me ready for this experience, so to my muscles, to get me ready for this experience. The fight or flight response is a survival response. If we think about it as helpful, our body perceives it as helpful. And then the other thing to think about is just to do a really simple breathing technique where you prolong your out breath. So when you breathe in, your heart speeds up. And when you breathe out, your heart slows down. So if you want to try and slow your heart down and do a bit of a hack in the moment to compose yourself, then this type of breathing technique is the simplest thing in the world, but it's really helpful. I think we try and say to ourselves, calm down, but turns out our physiology doesn't understand language. And so a quick hack in is to extend the out breath. And so I haven't put an exact amount here because it depends on people's lung capacity. But I tend to do things like, for myself, I breathe in fairly quickly for 5 seconds, and then I extend the out breath for 10 seconds. Okay, and then you just keep doing that for a minute or two until you start feeling a bit more composed. I often do this in meetings when I feel myself getting angry about certain things. Just practice that, is really helpful. And lots of people that we work with as well in brain injury kind of say it's really helpful to give them something to do in the moment. Great technique that you can use there. Just a top tip though, when you are really anxious and you're trying to use this technique, it could be quite easy to use it wrongly, in the sense that you think you're breathing slowly, but you're actually going, and that can make things worse, right? So if you do things like that, you can get certain apps on your phone. I've forgotten the name of it unhelpfully, but I can send that through again if you're interested. And you can, I think it's called the breath ball. And you can program in, so you can say to the ball, extends for 5 seconds and then deflates for 10 seconds. And because you've got something to follow visually, it'll stop you thinking that you're doing deep breathing when you're actually doing quite shallow breathing. And also put your hand on your diaphragm or stomach and try and breathe through your stomach and diaphragm rather than through your chest, if that makes sense. And I think that's a really good hack to kind of get yourself in a calmer place. Okay, next slide, please. So the other thing that is really lovely is mindfulness. And so you can go on do mindfulness courses, and I'm sure many of you hear about mindfulness, but I've heard about mindfulness, and obviously it's a type of therapy and you can do lots of different hours training in it and get qualifications in it. But at its simplest, it's really just about being aware of the here and now. So anchoring yourself in the moment and being aware of the here and now. And sometimes when you're really stressed, you're thinking about all of the things that you did do that haven't gone well, or all of the things that you've got to do, and you can spend very little time in the moment. So, as a stark example, I once went to an orchestra event, sat through it for an hour and a half, and left and thought I actually didn't watch any of that because I was too busy thinking about what I did in the day and what I had to do for the next couple of weeks. And I've got no idea what actually happened in that show. And so I think that's a really good example of, like, when you're getting stressed, you're not in the moment. And if you're not in the moment, you're not going to see some of the positive things that are happening, some of the beauty in nature, some of the kind things people do for you, because you're in a different place. So sometimes that is, I sort of think, with mindfulness, it can be complex or it can be really simple. You can drink a cup of tea mindfully. You can spend a few minutes stroking your dog mindfully, just savor in that moment before you go to work. You can mindfully play with your children before you go to work, paint something with them. You can mindfully wash dishes. You can mindfully eat sweets. So there's lots of things that you can do where you're just spending a few minutes just really focusing on the task you're doing, thinking about it from a visual perspective. What does it smell like? What does it feel like? What can you hear around you? And just anchoring yourself into that particular moment. And that's a really good strategy as well when you're getting stressed. And just from clinical practice, one of the things that some of our patients tell us they struggle with is eating out, because there's a lot of noise around them and they start to get really panicky. So we help them practice mindful eating, so that in the restaurant they can just focus on what the thing they're eating tastes like, what it feels like to cut it, and those sorts of things, just to get them into the habit of really centering in the here and now, because anxiety is usually about what might happen rather than what it actually is happening. And one of our PhD students that was on the slide that I showed you at the beginning has recorded a few meditations for mindfulness that are evidence-based, that have been shown to be really helpful. And I've put the links to those on our YouTube channel at the end of the slide if you wanted to give some a listen to. But there's plenty of free resources on the internet as well. Okay, next slide, please. Oh, there we go. There they are. And next slide, please. Okay. So another really, really practical, quick thing that you can do that makes a huge difference if you actually do it is this 3 good thing exercise. So lots of research now has shown that this can help really improve, increase, I guess, positive emotion. And so this is really simple. You just start your day, or at the end of the day, you just write about 3 good things, 3 things you're grateful for, 3 things that have worked really, really well for you, 3 good things that you've noticed. I'm sitting here today giving you some really, really straightforward strategies so that you can implement to improve your well-being. And one of the things that I'm really aware of is that sometimes these strategies sound so simple that people think they're never going to work. So they don't do them, and then they don't work. So, and I've definitely been guilty of that as well. But this thing really worked for me. So it was just about trying to increase my experience of positive emotion. I thought, well, I'm kind of, naturally quite a happy person. So this should be easy, but I actually really struggled with it, to find 3 good things at the end of the day. So I started writing them down, and the tip here is, obviously don't think about massive things, because nobody has 3 massive, brilliant things happen to them every day. Just think about things like when you were in your office, the sun came through and it hit, you could feel the warmth of that on your face, or one of your colleagues made you a cup of tea, or you got to spend some time with your children or your dogs in the morning, playing with them. So just those little things that happen every day that could go unnoticed, then just write them down. And the idea is that at first it's quite effortful. So you're trawling through your day, trying to think about good things that happen to write down. But as you do this more and more, so by about week 2, I was noticing the things as they were happening, and then I was thinking, I need to write that in my book. So I wasn't having to trawl through my head at the end of the day because I was labeling all these positive things as they happen. And that's the point of the exercise, that your brain starts to notice them when they're happening and encode them, whereas before that's not so salient. And I think as we are predisposed to notice the negative things and the threat that's happening around us, because the idea is that, you know, that kind of supports survival. Noticing the daffodils is not particularly helpful when it's all about survival, but and especially after trauma, that negativity bias that's quite natural in us is exacerbated, and in stressful situations for all of us. So this is kind of a helpful exercise, I think, in kind of resetting that a little bit and trying to focus on some of the positive things. There's a lot of research that shows that even though this is really simple, if you can sustain this for 3 weeks or more, it's really, really helpful for well-being. And it's not just about increasing positive emotion at the moment. The idea is that positive emotion is a tool that you can build positive emotion, and it supports problem solving and creativity. So this kind of exercise is a catalyst to support well-being at the moment, but also to support future well-being by increasing positive emotion, if that makes sense, and vagal function, which I talked about earlier. Okay, next slide, please. Okay, so I love this. When I started training, like you guys, you have to jump through hoops, and it's difficult and it's stressful. So I tried to notice the things that I was inherently not good at and made a real effort to invest some time in being better at those things. But I just naturally wasn't very good at some things, and I wasn't putting any attention into building the things that I was good at. And then I came across this strengths exercise. So, people talk about, what are your strengths, or what are your hobbies, or what you're good at. And then this brilliant group from the field of positive psychology actually studied character strengths. And they found that across different cultures and different populations, there was these 24 character strengths that people had in different degrees. So you can't really see that very well, but hopefully if we can share the slides with you, you'll be able to see that. But I've put a link to the questionnaire there. So there's a questionnaire that you can go to. You have to register. There's nothing weird about that. I don't know what that's about, but you just have to register, and then you're allowed access to the questionnaire. Presumably they use the anonymized data for research or something. But at the end of it, it'll give you your top strengths. It'll rank your strengths in order. And I just suggest that you do that and look at your top 5 strengths. So I've spent a lot of time thinking about how can I be more organized, for example, and actually my top 5 strengths were things like creativity and love of learning. And I thought, well, actually, I'm going to actually stop spending time investing a lot of time in things that I am not very good at, and start investing time in things that are my strengths. And it was very freeing. And then as a manager in a service, I was like, I'll try and recruit people that have got different strengths to me to offset some of the things that I bring. So as a team, we'll have a really good balance of strengths in our teams, as well as skills and knowledge. So one of the things that we do in our team in work is we each do these character strengths, and we share our character strengths with the team. And when we get new patients come into our group, we ask them to do their strengths, and then we ask them to introduce themselves to other patients and us by their top 5 strengths and give us examples about how they've used them. So one of the top tips I want to share with you is to identify what your top 5 strengths are and to use them. So use them all. So I remember a conversation I had once with a nurse, as it happens, and she was saying, I used to love my job. I don't know what happened. I got promoted and I got a new job, and all my colleagues recognized, how good I'd been in my career, and I got this new promotion, and I've never been less happy. And then when we talked about her strengths, they were about working with other people and capacity to love and be loved. They were really person-centered strengths. And she'd been promoted to an office where she was doing lots of disciplinary and management type stuff and having to kind of correct things that had gone wrong and put in incidents events. And she wasn't getting to do some of the things that really worked on her top strengths. And so when we thought about it that way, she was actually like, okay, that really makes a lot of sense. And so sometimes people have strengths, but they're not in roles where they can use them. And that's fine. Not everyone can have a job that meets their strengths. That's clearly a luxury. But it means that you need to look for opportunities outside of work or voluntary opportunities where you actually get the chance to use your strengths, because all of the research says that using those things that you're good at and they're unique to you supports your well-being. Okay, so I think that's a really helpful thing to leave you with. Next slide, please. So the other thing is, on the rat race of life, sometimes, again, this potentially is a very westernized thing. You get caught up in doing what you're doing, and you end up living a life that is so inconsistent with the things that actually matter to you. So you're kind of on a bit of a rat race. I don't know whether people in the audience can identify with his sentiments. And you're sort of thinking, you end up thinking, well, I think this happened a lot in COVID. People had time to reflect and they thought, what am I doing? And then there was like people making big changes in their lives. And so the links that I've put here is to help you think about what your values are as a person. So this is slightly different to strengths, but it's about thinking like what really matters to you as a person. And the second questionnaire is that if you were interested, you could look at is looking about, are you living life according to your values? So are you doing things on a day-to-day basis because you're in a rat race and because everybody else is doing them? Or are you actually living in a way that's consistent with the things that matter to you? And when I was talking about a balanced mind earlier, I talked about making room for difficult experiences. I've just been talking to you about building positive emotions through that 3 things exercise. This is about the other really important aspect about well-being is meaning and purpose, like living a meaningful and purposeful life. And living in accordance to the things that matter to you gives you an opportunity to experience things meaningfully. And those questionnaires are really helpful ways to just think about, am I living in accordance to my values, or what even are my values? And this again comes to that definition of well-being about connecting with yourself. Sometimes we lose touch of who we are because we're in the rat race of life, Okay, next slide, please. Okay, so again, healthy bodies, like I said, because our mind and body are very intimately connected, our health is really, really important to our well-being. And that's really obvious to some people. And that also goes vice versa. Our well-being is really, really important to our health. And so all of the research that we were reviewing were basically just saying in the domain of the healthy bodies, the important things were, not smoking, good quality sleep. So in the research that was coming out at about being between 7 to 9 hours, which is an absolute luxury for some people. But also bear in mind, there's a lot of variation around the average. So, if you've only ever slept 6 hours a night, it doesn't mean you're going to an early grave. It just means that the finding from group studies say that if you can try and get 7 hours sleep, that's ideal. And the sleep would need to be good quality, so it's not just about quantity either. And diet is obviously really important. So looking at all of the meta-analyses of different types of diets, really the Mediterranean type diet is coming out as being really important for supporting your health and well-being. Exercise, of course, is really important as well. And we've also added in there meditation. So again, that's really important to support a healthy body and mind. Okay, I'll come back to this again in a bit. Next slide, please. So there's some interesting resources that I've just put there for anyone that's really interested in diet, because Some really interesting initiative has happened lately. And I've put the result of the report there. It's from Eat Lancet. So it's the scientific community have come together, from those looking at diet to support health and well-being to others looking at diet from a point of view of sustainability in the planet. And they've really integrated those research findings together. And they've released a series of, at the Eat Forum, which I've put a link to at the bottom, have released a series of podcasts talking about merging our understanding of how we can eat to support our health and well-being and simultaneously eat to support our planet. So eating in a way that's really sustainable for our planet. And I think that's really exciting to think about. So if you're interested, please follow that up. Next slide, please. Okay, so again, a lot of times in the West, we talk about in our healthcare services, we kind of say the importance of stopping smoking, exercising, healthy lifestyle, all of those things support health and well-being. And we pay very little attention to social connection or connections, relationships with others and our communities. And it turns out that this is one of the most important impacts on health and well-being, and it rivals well-established risk factors like smoking cessation. So it will rival or it had the risk of not having good social connections was the same as smoking 15 cigarettes a day. And there's a study, the amazing study there that I've referenced that talks about those things. So social connection is really important. I don't think we utilize the importance of that enough in healthcare. And I don't know whether we do that together, but it's talking about, you know, the literature saying about having a sense of belonging, having a community. I mean, nursing now is a really good example of that. Is bringing people from across the world with under the banner of the same profession, the same nursing identity, bringing people together for support. So a sense of belonging and professional identity and is really, really supportive for well-being. And we can think about our communities as being where we live, like our neighborhoods, but it can also be, if we work somewhere different, our communities can be a place where we feel a sense of belonging to a group. So I've said that, love this quote at the bottom: community, in a word, is the beating heart of life, and we neglect it at our peril. And certainly in the West, community is becoming fragmented, and that's contributing to loneliness and increased social isolation, which is massively contributing to the global burden of disease. Okay, next slide, please. So just in the interest of time, I won't go through all of this, but I've pretty much just said it. But this is just some of the research showing that social relationships make a huge contribution to health and well-being. Next slide, please. And so one of the last domains that I wanted to talk to you about, second to last, is connection with nature. So again, this is something that's like really, we don't really think about very much in terms of delivering healthcare, at least in the West. Next slide, please. I'll just tell you some of the kind of science behind this. I was surprised at this when I read about it, several years ago now, because I don't think we appreciate how connecting with nature is helpful to us. But people, and certainly in our society in the West, people have become increasingly disconnected from nature. And I know that is the case. People becoming disconnected from nature in other parts of the world as a function of climate change. It's had to happen. So there's a lot of robust population studies, including samples of millions of people, that have shown that the proximity to green and blue spaces significantly reduces the risk of all-cause mortality. That nature connectedness, feeling a sense of connection to nature, improves well-being, improves health outcomes. I've said all-cause nature, but there's lots of studies showing that improves reduces risk of cardiovascular disease, stroke, all kinds of different chronic diseases. as well as promoting nature connectedness promotes pro-sustainable environmental behaviours, which we need more than ever now. So recent systematic reviews have shown that gardening interventions were associated with really large beneficial effects on a variety of health related outcomes, especially when they're in groups, again, because you get a sense of social connection, especially if it would connect to your values because you feel like you're doing something meaningful. And there's lots of evidence now that's saying nature connectedness should be a core health guideline, because spending up to 120 minutes in nature a week is associated with good health and well-being at the population level. But we saw things like health inequalities and socio-structural factors really impinge on people's health and well-being because, for example, in Wales in COVID, lots of people from poorer backgrounds were locked in flats without any access to green spaces in their immediate vicinity. So one of the things I talked to you a little bit about at the beginning was just kind of saying health and well-being isn't always under our volition. So I'm talking about spending time in nature, but some people with better opportunities have got more access to green and blue spaces than others. And so if we're going to think about supporting well-being, we need to be thinking about that from an individual point of view, but also from a governmental point of view. And one thing that happened in Wales is that there was a pledge after COVID to make green spaces accessible within a 5-minute walk of most people, people everywhere. But obviously, the more we're building, the less green spaces we have. So again, this is why I started by saying we really need to think about how can we improve our own well-being and improve the well-being of the planet, which clearly gives so much back to sustain health and well-being for us. Okay, next slide, please. So this is, I'm probably going to end about here because I don't have much time left, but this is just thinking about what we do a lot in, at least in my culture, is we give out a lot of leaflets telling people what to do. So we give out leaflets telling people about smoking cessation or how to eat healthy or how to exercise more. And I don't think there's anyone in this room when I talked about health behaviors that probably wasn't thinking, oh my God, I know this. Everybody knows that. That's not the problem. So I really love the phrase, common knowledge is not common action, or information is not transformation. So again, lots of people know this stuff, but not many people are able to implement what they know into real change. So I'm probably not the only person on the call that's been on multiple diets, that has enrolled in multiple gym memberships and been a few times and had to cancel the subscription and felt really guilty about wasting the money. The idea is I knew what to do, but I really wasn't very good at doing it. So a key part of well-being is understanding behavior change. So it's not about necessarily just understanding what we need to do, but how to do it. And so one of the most helpful things that I know that I learned from this was what are the key drivers of behavior change. So these are the 5. So some studies have kind of done a trawl through all of the studies there are in the literature, and produced several meta-analyses that were saying these are the core things that will help you change a behavior you want to change. So thinking about changing your diet or thinking about exercising more. And one of them is about, so one of the core things is about motivation. So how much you enjoy the activity is a better predictor than how much you really want it. So if you're having to go on a diet because your health's poor, that seems like it would be a really good motivating factor. But the research is saying, actually, no, the most important thing in sustaining a behavior change is whether or not you enjoy it. And I think that's really helpful to know about, because that kind of meant that the gym was never going to be for me. So if there's people here on the call that the gym's not for, and you just keep trying to make yourself go back because you've got a really good reason to want it to be there, it actually just means that maybe the thing you have to do is actually sample quite a few different types of exercise and find one that you actually enjoy. if that's the thing. I think it's probably a thing. I found hiking, so I enjoy that, and there's lots of other health benefits from doing things like that. But I struggle trying to find something to. So I think it's about trying things. That was helpful to know. The other thing that's helpful to know is willpower. Think about it like a sand timer that doesn't last throughout the day. So it gets depleted when you have to make difficult decisions, and they're not just decisions about the behavior you're trying to change. Like I'm just thinking about sometimes when you go to a coffee shop and you have to make about 1,000 choices to get your coffee, about what kind of syrup you want it, how hot do you want it, what kind of cup do you want it in. All of those kind of decisions you're having to make are quite depleting. And so usually you've used up your willpower by lunchtime. And so lots of people will say, I was fine all day, and then I came home and I hit the fridge. So that's kind of saying, look, willpower is helpful, but it's a limited resource, so you can't rely on it. So you have to try and take that volition out of play if you can. And that comes down to planning. So it's kind of saying, actually, how can you make the behavior that you're trying to do as easy as possible? So this sounds really simple, but if I'm trying to eat healthily, then one thing that I can do to make things really easy for myself is to put fruit all around my house and to get rid of all of the food in the cupboard that I might go and snack on. So it's kind of thinking, how do you make the desired behavior really easy and the difficult behavior really hard? So you haven't got to put loads of effort into resisting the thing that you don't want and to get in the thing that you do want. Again, so if we just go back to motivation and enjoying something, if you're eating food that you hate, then you're not enjoying it. It's going to be hard to sustain the behavior. So one thing that might be really helpful to do is actually try and focus on cooking 1 or 2 healthy meals that you really like that are quick. And so I guess what I'm trying to say to you there is that try and think about the thing that you're doing is to find a way to enjoy it rather than how to change something, if that makes sense. And then once you found those things you enjoy, in order to establish it as a habit, you have to repeat it and repeat it and repeat it until it becomes part of what you do, like brushing your teeth without even thinking about it. It becomes an automized behavior. So you want to try and get your behavior that you want to change that was really effortful to become as effortless as possible. And the transition from something effortful to effortless is repetition. So if you remember when you started driving, it was effortful to start with, now it's effortless. So repetition is the key to that. And you'll see a lot of TED Talks and things where people talk about repetition, and they say that, say if you've decided, right, I'm going to go on the treadmill, if you psych yourself up and you're like, oh God, I'm going to need to do 40 minutes, that's the goal I've set myself, but I can't be bothered. It's better to get on there and do 1 minute and get off than not to get on there at all, because then you can say you've repeated the behavior. And the chances are when you do get on there for your 1 minute, you'll do more than 1 minute, but it's the getting started that requires a lot of the energy, if that makes some sense. And then there's things like social influences. They're a big determinant, like maybe having people around to go with, or if you're trying to find an exercise that you like, it might be that if you're more of a people person, you should join something as a team sport or a running group or something that you can do with other people. If you feel like being accountable is helpful for you. I actually like hiking because you can do it on your own and you get that headspace sometimes to defry from life. And then again, headspace is another big determinant. So one thing that can stop you changing your behavior is that you're just on autopilot and you haven't given yourself any space to think about how am I going to approach doing this, even if it's 10 minutes. So people that like give themselves planning time to think about how to do this properly, and reflection time to think about when things worked or didn't work, that's really helpful. And the final thing is trying to make things really easy for yourself. So if one of the issues is you want to go to the gym, but you're just lying in bed thinking, oh my God, I don't know where my shoes are, my gym kit's not clean, there's one shoe downstairs, there's another one upstairs, the dog's chewed it, all of these sorts of things, you're just using up all your willpower. You're thinking about all the reasons why you can't go, and in the end, you probably just press snooze and go back to sleep. If your gym kit's by the door, it's so much easier for you to just get up, grab it, and go. And so I know these things sound really simple, but in a world where we're all rushing around at 1,000,000 miles an hour, that's why it comes down to planning and headspace, trying to make the desired behavior really easy and the difficult behavior really hard. Okay, so those are the things that actually, that information really helped me make some changes that were sustainable. So I really hope that they've been useful for you. Next slide, please. Here's just all of the different domains that I've thought about. I've just put this here for you to have that slide. So you can really just spend some time reflecting on, if these are all of the different determinants of well-being, which areas might I improve on in my own life? So you can just shade in. I think the idea is, if you shade in the whole, all of the segment, then you've got lots of good well-being in that place. And if you just leave little gaps, then there's room for improvement. So it helps you work out, where do I start? Because some people say, I want to improve my well-being. Well, that's a massive thing. Like, where do you start within that? And so that's just something that you might want to start with if you're thinking about making some changes. Next slide, please. Just flick through these. These are just some references that, if anyone's interested in the academic stuff that we've written to get us to some of the things I'm talking to you about today. So you can flick through them, they're just for you. And I just wanted to end by saying that, on behalf of myself and Same You, thank you guys so much for all of the vital work you do as nurses. We really appreciate you. And I hope that some of the stuff, or all of the stuff that I've said to you today, has been helpful. Thank you very much.
Thank you so much, Zoe, for bringing us into your beautiful world and for setting the tone for well-being today. I loved that you shared all of the different definitions of well-being, because it really is so many things encompassed into one, and also for bringing up that theme of connection, whether it be connecting to yourself, to your patients, or to one another, like this virtual room that we have today. We'll be continuing that theme as we look forward to our next speaker, Sue Dean, who will be connecting us to nature through restoration practices. I hope that you remain with us as we grow into this next session, and thanks again for joining.
Thank you, everyone.